Welcome to this month's Safety Talk Hygiene and Infection Control. This video is going to discuss the importance and different types of hygiene and how to implement these. What is hygiene? Workplace hygiene refers to the practices and policies put in place to maintain a clean and healthy work environment. This includes personal, environmental, and hygiene as it pertains to food, with extra stress on hand hygiene. Importance of hygiene. Health and safety. Good hygiene and infection control measures help protect employees from contagious diseases by preventing the spread, thus promoting a healthier work environment. Productivity. A clean and organized workspace can boost employee morale and productivity. Professionalism. Maintaining hygiene reflects positively on the company's image and reputation. Personal hygiene. Personal hygiene is crucial for maintaining health and well-being, especially in the workplace. It helps prevent the spread of infections, promotes a positive image, and enhances overall productivity. Best practices for personal hygiene include, but are not limited to: cover your mouth and nose with a tissue or your elbow when you cough or sneeze. Dispose of tissues immediately and wash your hands afterward. Shower or bathe daily to remove dirt, sweat, and bacteria. Use deodorant to control body odor. Keep your nails trimmed and clean. Wear clean clothes and change them daily. Ensure your work attire is appropriate and well maintained. Keep your hair clean and neatly styled. Environmental hygiene. Environmental hygiene refers to the practices and measures taken to maintain a clean and healthy physical environment in the workplace. A clean environment reduces the risk of infections and illnesses, ensuring a healthier workforce, and can boost employee morale and productivity. Best practices for environmental hygiene include, but are not limited to: ensure that all surfaces, especially high-touch areas like doorknobs, keyboards, and phones, are cleaned regularly. Use appropriate disinfectants to kill germs on surfaces. Follow the manufacturer's instructions for proper use. Dispose of waste properly, and ensure that bins are emptied regularly to prevent overflow and contamination. Ensure proper ventilation in the workplace by opening windows or using air purifiers. Encourage employees to stay home if they are feeling unwell to prevent the spread of illness. Ensure that there are adequate supplies of cleaning products, hand sanitizers, tissues, and personal protective equipment (PPE). Regularly check and maintain cleaning equipment to ensure it is in good working condition. Use clear signage to remind employees of hygiene practices and protocols. Food hygiene. Food hygiene in the workplace is crucial for preventing foodborne illnesses and ensuring the safety of everyone who consumes food prepared or handled there. Even though we are not in the food industry, this is still relevant with food being consumed in the workplace because proper food hygiene reduces the risk of illnesses caused by bacteria, viruses, and other pathogens. Best practices include: clean and sanitize all surfaces, appliances, and utensils in the kitchen or break room regularly. This includes countertops, microwaves, refrigerators, and sinks. Ensure that trash bins are emptied regularly and kept clean to prevent odors and pests. Store food at safe temperatures. Refrigerate perishable items promptly and ensure the refrigerator is set to the correct temperature. Label and date all food items to keep track of freshness and avoid consuming expired products. Clean and sanitize all utensils after each use. Display clear guidelines and reminders about food hygiene practices in the kitchen or break room. Conduct regular checks to ensure that kitchen appliances are clean and in good working condition. Hand hygiene. Hand hygiene is a simple yet highly effective way to prevent the spread of germs and keep employees healthy in the workplace. It reduces the risk of spreading infections such as colds, flu, and gastrointestinal illnesses among employees by decreasing the amount of germs being spread. When to wash your hands: before and after eating or preparing food, after using the restroom, after blowing your nose, coughing, or sneezing, after touching garbage, before and after treating a cut or wound anytime they are soiled. Proper hand washing. 1. Wet your hands with clean running water, warm or cold, turn off the tap, and apply soap. Rub your hands together with the soap. Be sure to lather the backs of your Hands between your fingers and under your nails. Scrub your hands for at least 20 seconds. Need a timer? Hum the happy birthday song from beginning to end twice. 4. Rinse your hands well under clean, running water. 5. Dry your hands using a clean towel or air dry them. What is infection control? Infection control refers to the policies and procedures used to minimize the risk of spreading infections, particularly in environments where people work closely together. Infection control measures. Effective infection control measures help prevent the spread of infectious diseases among employees. This reduces the risk of outbreaks and keeps the workforce healthy. This is important for many reasons, including by minimizing the spread of infections, companies can maintain a more consistent and efficient workflow. Some employees may have weakened immune systems or underlying health conditions that make them more susceptible to infections. Infection control measures help protect these individuals from potential health risks. A clean and hygienic workplace fosters a positive environment where employees feel safe and valued. This can boost morale and contribute to overall job satisfaction. Types of measures we will talk about include the role of PPE, cleaning and disinfecting, waste management, and monitoring AMP, reporting. Role of PPE, personal protective equipment (PPE), plays a crucial role in infection control in the workplace by acting as a barrier between individuals and potential hazards. It provides a physical barrier that reduces exposure to pathogens from infectious agents, as well as protection from hazardous chemicals and substances. Types of PPE. Masks and respirators. Protect the respiratory system by filtering out harmful airborne particles and preventing respiratory infections. Gloves shield hands from contact with infectious materials, chemicals, and other contaminants. Gowns and aprons protect skin and clothing from exposure to infectious agents and hazardous substances. Eye and face protection. Safety glasses, goggles, and face shields protect the eyes and face from splashes, sprays, and infectious droplets. Footwear. Protective footwear prevents injuries and exposure to hazardous materials on the ground. Proper use of PPE. Education. Educate employees about the importance of PPE and how it contributes to infection control, compliance. Encourage compliance with PPE protocols through regular reminders and monitoring. Feedback. Solicit feedback from employees on PPE usage and address any concerns or barriers they may have. Cleaning and disinfecting. Cleaning and disinfecting are both important for maintaining a healthy environment, but they serve different purposes. Cleaning removes dirt, dust, and impurities from surfaces. It involves using soap or detergent and water to physically remove germs, but it doesn't necessarily kill them. Disinfecting, however, kills germs on surfaces using chemicals. This process is essential for reducing the spread of infections. Being a green company, our disinfectant products are chemically different than generic products, thus making it extremely important to follow through with cleaning and disinfecting practices. Waste management. Effective waste management is a critical component of infection control in the workplace. Proper handling, separation, and disposal of waste help prevent the spread of infections and protect the health of employees and the community. Best practices include: distinguish between infectious and non-infectious waste. Infectious waste includes items contaminated with blood, bodily fluids, or other potentially infectious materials. Implement a system to ensure proper separation. Train employees in safe handling practices to minimize the risk of exposure to infectious waste. Use appropriate PPE such as gloves and masks when handling waste. Store waste in secure, labeled containers to prevent accidental exposure and contamination. Ensure that storage areas are clean and well maintained. Adhere to local, state, and federal regulations for the disposal of infectious waste. This may include incineration, autoclaving, or using licensed waste disposal services. Use designated sharps containers for blades, scrapers, and other sharp objects. These containers should be puncture-resistant and clearly labeled. Clean and disinfect waste storage areas regularly to prevent the buildup of contaminants. Have protocols in place for managing spills of infectious materials. including immediate cleaning and disinfection, provide regular training, and provide proper signage on waste management practices. Monitoring and reporting. Monitoring and reporting help identify potential issues, track the effectiveness of infection control measures, and ensure compliance with health and safety regulations. Monitoring includes regular audits, conduct regular audits to assess adherence to infection control practices. This includes monitoring hand hygiene, use of personal protective equipment (PPE), and cleaning protocols. Surveillance. Implement surveillance systems to track infection rates and identify trends. This can help in early detection of outbreaks and prompt intervention. Environmental monitoring. Regularly test surfaces and air quality to ensure that the workplace environment is free from contaminants. Reporting includes incident reporting. Encourage employees to report any breaches in infection control practices or incidents of potential exposure. This helps in timely investigation and corrective action. Feedback mechanisms. Provide regular feedback to employees on their adherence to infection control practices. This can be done through meetings, reports, or digital platforms. Compliance reporting. Ensure that all infection control activities are documented and reported to relevant authorities as required by regulations. Conclusion. In conclusion, maintaining workplace hygiene and effective infection control practices are essential for creating a safe, healthy, and productive environment. Ensuring proper hygiene in all areas, as well as taking the proper measures to prevent infection from spreading, reduces the risk of illness and absenteeism, leading to a more productive workforce. This will also promote a clean and safe workplace, which will boost overall morale and satisfaction. If you have any questions or concerns, please ask your manager or reach out to HR for help.